David, analytics has become a big part of the world of manufacturing, of the world of financial services, even athletics. You've seen it as it came into the world of healthcare. You were a part of that whole expansion. I'd love to hear you talk a bit about how analytics took hold in the world of healthcare.
Sure, Mark. At first, we thought that predicting future costs would be sufficient for helping improve medical outcomes. But sooner or later, we began to realize that that's not sufficient. So we actually had to build a lot of sophisticated models looking at multiple outcomes variables. Okay. And on top of that, we actually had to understand when was the opportune moment to engage patients and then intervene at that moment to produce positive outcomes. So it was really a collection of all kinds of predictive models as well as outcomes analysis and engagement models and so on. So we had to actually integrate all of these different models into one coherent unit to make an impact.
Let's unpack that for a second, because one of the things you just said is the notion of two things. There was the moment to intervene and then thinking about the intervention itself. I'd love to have you talk about that a bit, because it's understanding the different kinds of patients and what the right moment is for that patient, right?
So what we ended up doing was essentially trying to understand what were those engageable moments for our patients. Okay. So we had to implement complex event processing to really understand what events are occurring throughout patient's life and what sequence of events actually constitute moments of engagement. And then we basically intervene at that opportune moment and then measure outcomes real time to understand which interventions were making impact at what point in time, under what context, for which patients.
Yeah, so in some ways the inside analytics helped you understand the life cycle of the patient and those engageable moments. And then you started thinking about the action analytics, what the intervention was going to be and how you were going to do it. Talk a little bit about how you tested the interventions.
We work with experts to come up with multiple intervention channels, including wellness all the way to catastrophic case management. So the idea was each patient is different, they have their unique needs. So we were trying to understand which of these interventions would produce the highest impact under what point in time. So we actually had to build models to predict what is likely to happen in the future and what interventions would be most impactful given those particular future events that are likely to occur, and apply those interventions, measure outcomes, and continuously improve our system over time, because in the beginning, you're not 100% certain in terms of what's going to really work. So we tried all of these different methods in real time, really fast, so that we learn fast and then basically adapt our system to what we learned from this kind of a closed feedback loop.
So you deploy a whole series of interventions and monitor which ones work and how effectively. And one of the things that I know you're pretty passionate about is the idea of the data being at the front lines so that people can interact with it. And talk a little bit about how those interventions took shape, because some of them, I guess, would go right to the patient, some would go to doctors, some would go to nurses. How did that work?
It's really a triage program in that, yes, some interventions apply to physicians and care managers and others apply to patients, but the basic idea is how to coordinate those activities to minimize waste in the system as well as improve patient outcomes to the best extent possible. And what we ended up doing was that, yes, data is data, but data without actionable insights is virtually useless. Yeah. So what we ended up doing was try to understand what portion of data is really responsible to helping us improve patient outcomes through these interventions. And once we understand what interventions are effective, then how do we keep changing those interventions over time? Because patients would become a little bit tired of listening to the same message over and over. So we know when these messages or interventions become less effective over time. So you would basically substitute constant new interventions over time.
So the interventions can take all kinds of shapes. They could literally be messages, they could be drug protocols, they could be all kinds of things. And so part of the idea is figuring out what kind of message do you deliver to the patient, what kind of message is best delivered through the nurse, what best message is delivered best through the doctor. Is that right?
Yeah, I mean, it's basically all of these interventions could be delivered to patients through multiple channels. And we looked at coaching channels through traditional, let's say, call centers. Okay. And we also looked into different real-time communication channels, including SMS and smartphone applications. And we also looked at collecting data real-time through smartphones so that we can do a much better job of understanding what's happening to these patients real-time. And in the end, what's really effective is basically you have to intervene when certain chain of events occur that constitute really opportune moments of engagement.
Yeah.
Otherwise, if you send the wrong message at the wrong time to the wrong patient, it doesn't work at all. So you really have to have real-time information and act accordingly.
Interesting. So I mean, the idea is the right message at the right time can be powerful, but if it's sent at the wrong time, it literally just the effect washes out.
That's 100% correct. And we also did some analysis to understand how we can vary tones and focuses of these messages to produce impact in our patients. And those were quite interesting in terms of how you should be sequencing and writing these messages to produce the type of impact that we're expecting from our intervention.
So David, let's talk a little bit about the impact of those interventions and those, that insight innovation, right? What kind of impact did you actually see in the healthcare world of doing this kind of analytics work?
So we really focused on understanding micro impacts, because if you look at traditional, let's say, clinical trials, it takes 1 to 3 years to see any kind of outcomes based on monolithic interventions. So what we were trying to do was basically break down outcomes into multiple little things that we can observe over time through sensors and other types of applications. So what we'll do is apply this type of real-time micro interventions, measure outcomes real-time using these sensors, and that's how we know that we are making an impact without having to wait for 1 to 3 years to see if we made an impact.
And what are the kind of impacts? It's health and wellness statistics and also money saved probably, right?
Of course, we looked at the number one outcomes is ROI from our clients. So essentially, we are seeing outcomes in the area of ROI of about 2 to 4 to 1 kind of ish. So that was fairly reasonable. And in terms of behaviors, we are seeing improved, let's say, exercise patterns and improved weight loss, as well as we saw improvements in some of the biomarkers such as cholesterol, triglycerides, HDL, and so on.
As you think about bringing that work into the world of education, what kind of gets you excited about that?
Well, I've been always interested in applying technology to help people.